Hello, I'm Dr. Edward Pearson, a hematologist in Dallas, Texas. I specialize in bone marrow and blood disorders with a focus on leukemia, lymphoma, myeloma, and the myeloproliferative neoplasms. I have a number of patients with polycythemia vera. Polycythemia vera does present some very unique challenges for these patients. BESREMi is a monopegylated interferon for the treatment of polycythemia vera. It is in the NCCN guidelines for the treatment of patients with PV as a first-line option.
Indication: BESREMi is indicated for the treatment of adults with polycythemia vera. Important safety information. Warning: risk of serious disorders. Interferon alpha products may cause or aggravate fatal or life-threatening neuropsychiatric, autoimmune, ischemic, and infectious disorders. Patients should be monitored closely with periodic clinical and laboratory evaluations. Therapy should be withdrawn in patients with persistently severe or worsening signs or symptoms of these conditions. In many, but not all cases, these disorders resolve after stopping therapy.
In the PEG and vera trial, patients were treated with BESREMi for over 7.5 years, with 80% of those patients achieving a complete hematologic response. That means the patients kept their hematocrit under 45% in the absence of phlebotomy, a leukocyte count under 10, and a platelet count under 400. 61% of patients achieved comprehensive disease control. The most common reported adverse reactions, defined as treatment-emergent adverse events throughout the 7.5-year treatment period, were influenza-like illness, arthralgia, fatigue, and pruritus. BESREMi is an appropriate choice for patients with either high or low risk polycythemia vera who require cytoreductive treatment. I will also use BESREMi in patients who are on hydroxyurea and were either unable to tolerate the hydroxyurea or who find it ineffective. For those patients who are currently just on aspirin and phlebotomy, if the phlebotomy is poorly tolerated or it is failing to keep the hematocrit under tight control, I will switch those patients to BESREMi in order to get better control of their disease. In my personal practice, I will generally tend towards younger patients who are more motivated for the long-term treatment of their disease. It's important to keep in mind that younger for patients with polycythemia vera doesn't necessarily mean what it does with other diseases. The average age of diagnosis of PV is 68. I also like to use BESREMi in my patients who are earlier in the course of their disease. I find these patients who are not currently symptomatic but are requiring numerous phlebotomies are a particularly good choice for the drug. BESREMi is initially dosed on an every 2-week protocol. However, after a year of hematologic stability, the patient can transition to a once every 4-week dosing schedule. There's also a huge psychological benefit for the patient when they make that switch from every 2 weeks to every 4 weeks. Sometimes it feels like a graduation almost, where they've gone up to the next step. If drug-related toxicities do arise, it's important to reduce the dose of the medication or hold BESREMi until those symptoms improve. If the patient does not have adequate disease control on that lower dose, you can resume titration of the drug upward once those symptoms have gotten down to a grade 1 or completely resolved. In my personal practice, depending on how severe the symptoms are, I may include a dose decrease when I'm resuming them on BESREMi. The process of dosing BESREMi is spelled out in great detail in the package insert. It's important when treating the patients with BESREMi that they come in for laboratory monitoring of their disease. It's also important to discuss with the patient any side effects that they may be having so that you can start treatment or otherwise adjust the dose of the medication to fix those symptoms as early as possible. I don't want them sitting at home and suffering without contacting my office, as there's almost always something we can do to improve any side effects they're having from the drug. During the titration phase, I do see patients pretty commonly. When the drug is first getting started, I'll see the patient every 2 weeks or have a nurse practitioner follow up with them every 2 weeks. As you achieve hematologic stability and no new symptoms are arising, you can space out those visits potentially every 3 to 6 months. In my personal practice, if a patient's on interferon, I see them quarterly. Speak with the patients, make sure they understand they may still need to get phlebotomies as they are up-titrating the medication. It's always a very satisfying moment when a patient has gone 3, 6, or 12 months without a phlebotomy, and you get to remind them of, it being their 12-month anniversary since they've had a phlebotomy. The long-term effects of disease control are very satisfying. In the PEG and vera trial, at 10 weeks on BESREMi, 27% of patients had achieved comprehensive disease control, with an additional 44% of patients achieving a partial response. For the 61% of patients who achieved comprehensive disease control, the median time to achieve that comprehensive disease control was 7.8 months. My experience with BESREMi has been similar to the clinical trial results. I think these clinical trial results really highlight the need for patient education so that they understand it needs to be given a fair amount of time to work. Hematology is very much a team sport, so the education and ongoing care of the patient is a collaboration between the physician, nurse practitioner, and nurses. The nurses have a very important role, as they are oftentimes the first person who speaks to the patient when they're having a problem. It's important that the additional members of the team know things about this drug and are able to offer some counseling, and most importantly, notice any red flags that need to be brought to the physician's attention immediately. Patients will have P-vera for the rest of their life. This sort of medication that offers long-term disease control is vitally important.
Indication: BESREMi is indicated for the treatment of adults with polycythemia vera. Important safety information. Warning: risk of serious disorders. Interferon alpha products may cause or aggravate fatal or life-threatening neuropsychiatric, autoimmune, ischemic, and infectious disorders. Patients should be monitored closely with periodic clinical and laboratory evaluations. Therapy should be withdrawn in patients with persistently severe or worsening signs or symptoms of these conditions. In many, but not all cases, these disorders resolve after stopping therapy. Contraindications: existence of or history of severe depression, suicidal ideation, or suicide attempt. Hypersensitivity to interferons or any inactive ingredients. Moderate or severe hepatic impairment. History or presence of active serious or untreated autoimmune disease. History of transplantation and receiving immunosuppressant agents. Warnings and precautions. Depression and suicide. Closely monitor patients for any symptoms of psychiatric disorders and, if needed, consider psychiatric consultation and treatment or dosage modifications as listed in the full prescribing information. Endocrine toxicity. Do not use BESREMi in patients with active serious or untreated endocrine disorders associated with autoimmune disease. Evaluate thyroid function in patients who develop symptoms suggestive of thyroid disease during BESREMi therapy. Discontinue BESREMi in patients who develop endocrine disorders that cannot be adequately managed during treatment with BESREMi. Cardiovascular toxicity. Patients with a history of cardiovascular disorders should be closely monitored for cardiovascular toxicity during BESREMi therapy. Avoid use of BESREMi in patients with severe or unstable cardiovascular disease or recent stroke or myocardial infarction. Decrease peripheral blood counts. Monitor complete blood counts at baseline, during titration, and every 3 to 6 months during the maintenance phase. Pancreatitis/colitis/pulmonary toxicity. Interrupt BESREMi treatment in patients with possible pancreatitis, colitis, or pulmonary toxicity and evaluate promptly. Consider discontinuation of BESREMi in patients with confirmed pancreatitis or who show signs or symptoms of serious ulcerative or hemorrhagic colitis, or who develop pulmonary infiltrates or pulmonary function impairment. Ophthalmologic toxicity. Advise patients to have eye examinations before and during treatment. Discontinue BESREMi in patients who develop new or worsening eye disorders. Hyperlipidemia/hepatotoxicity/renal toxicity. Monitor serum triglycerides, liver enzymes, hepatic function, and serum creatinine at baseline and during therapy. Avoid use of BESREMi in patients with eGFR less than 30 milliliters per minute. Discontinue BESREMi in patients with persistently marked elevated triglycerides, evidence of hepatic decompensation, or if renal impairment develops during treatment. Dental and periodontal toxicity. Patients should have good oral hygiene and regular dental examinations. Dermatologic toxicity. Consider discontinuation of BESREMi if clinically significant dermatologic toxicity occurs. Driving and operating machinery. BESREMi may impact the ability to drive and use machinery. Patients should not drive or use heavy machinery until they know how BESREMi affects their abilities. Patients who experience dizziness, somnolence, or hallucination during BESREMi therapy should avoid driving or using machinery. Embryo-fetal toxicity. Based on the mechanism of action, BESREMi can cause fetal harm when administered to a pregnant woman. Obtain a pregnancy test in females of reproductive potential prior to initiating treatment with BESREMi. Advise females of reproductive potential to use an effective method of contraception during treatment with BESREMi and for at least 8 weeks after the final dose. Advise women not to breastfeed during treatment and for 8 weeks after the final dose. Adverse reactions. The most common adverse reactions reported in greater than 40% of patients were influenza-like illness, arthralgia, fatigue, pruritus, nasopharyngitis, and musculoskeletal pain. Drug interactions. Patients on BESREMi who are receiving concomitant drugs, which are CYP450 substrates with a narrow therapeutic index, should be monitored to inform the need for dosage modification. Avoid use with myelosuppressive agents, narcotics, hypnotics, or sedatives, and monitor patients receiving the combination for effects of excessive CNS toxicity. To report suspected adverse reactions, contact Pharma Essentia at 1-800-999-2449 or FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. Please see full prescribing information, including boxed warning.